Hello and welcome for a webinar on study of oral cavity. And this study includes the anatomy of mouth, anatomy of tongue, anatomy of palate, including palatine tonsils. I welcome you all for this brief study, precise study, which is important for your examination also because questions are commonly asked on palatine tonsils and tongue. Sometimes questions are also asked on soft palate, uvula, adenoids. Okay. Now what is oral cavity? In short, oral cavity means mouth. You can see in this image. It extends from the lips, which is to the oropharyngeal isthmus. Okay, lips to oropharyngeal isthmus, because after that pharynx starts. The oropharyngeal isthmus is the junction of mouth and pharynx. So here, this you can see this hole here. This is a junction, oropharyngeal isthmus. It is bounded above by the soft palate and the palatoglossal fold. Palatoglossal fold means palate to the tongue. It's called as palatoglossal folds. And below by the dorsum of the tongue. This dorsum of the tongue means upper surface of the tongue. Now mouth is subdivided into two parts. Our oral cavity is subdivided into two parts. First is vestibule and other is oral cavity proper. Oral cavity proper means area beyond the alveolar margin or teeth, what you call. दाताच्या आणि ओटाच्या मधली जागा असते त्याला वेस्टिब्यूल म्हणतात आणि ओटाच्या मागची जागा असते त्याला ओरल कॅव्हिटी प्रॉपर म्हणतात. So what is vestibule? You can see the vestibule here. It's a space between the lips and the teeth and gums. You can see. It is a potential space actually. It is a slit-like space between the cheeks and the gums. In other words, it communicates with the exterior through the oral fissure. So when you open the mouth, it opens, and when you close the mouth, you can see the fissure here. दोन ओठ मिटवल्यानंतर जी फट असते त्याला आपण फिशर म्हणतो, ओरल फिशर. When the jaws are closed like this, when the jaws are closed, it communicates with the oral cavity proper behind the third molar tooth on each side. Even if you close the jaws, still there is a little space behind the third molar tooth which communicates on each side. Superiorly and inferiorly, it is limited by the reflection of the mucous membrane from the lips and cheeks onto the gums. So this is a vestibule of mouth. Okay, small space. So on the vestibule, if you study further, you'll see the lateral wall of the vestibule is formed by the cheek. Okay, both the sides. And cheek is composed of buccinator muscle covered laterally by the skin and medially by the mucous membrane. A small papilla means elevation on the mucosa opposite to the upper second molar tooth marks the opening of the duct of the parotid gland. So I told you during the study of salivary glands. So there is a opening of salivary gland, that is Stenson's duct, opposite upper second molar tooth. So at that place there is a papilla. Papilla means elevation. Elevation म्हणजे उंचवटा. On that papilla, the Stenson's duct opens. Yes, now I'm on mute. Oral cavity proper, it is the cavity within the alveolar margins of the maxillae and the mandible. Maxillae and the mandible. Maxillae means upper jaw, because there are two maxillary bones, so maxillae. And mandible means lower jaw. Alveolar margin means where the there is alveoli. Alveoli means spaces. त्या alveoli मध्ये teeth असे रुतलेले असतात. So it is called as alveolar margin. And the roof of the oral cavity is proper, is formed by the hard palate in the first part, and that is called anteriorly, and the soft palate posteriorly. So palate is in hard and soft. And the floor of the oral cavity proper is formed by the mylohyoid muscle, because it is just below the tongue. The anterior two-third of the tongue lies on the floor, because anterior two-third tongue is mobile. It lies on that. So this is about oral cavity proper boundaries. Now only floor of the oral cavity we will try to understand. Floor of the mouth in short. It is covered by the mucous membrane, and in the midline a mucosal fold called as frenulum connects the tongue to the floor of the mouth. So tongue is always kept hold by this frenulum. On each side of the frenulum, a small papillae has opening of the duct of submandibular gland. So there is a small papillae, means small elevation. On that there is opening of the submandibular gland. So always the ducts open on a papillae. उंचवटे असतात त्याच्यावरतीच ती duct open होते. Okay. A round edge extending backward and laterally from the papillae is produced by the sublingual gland. So sublingual gland, you can see on the side of the opening of submandibular gland. Now what is the nerve supply to the mouth? Now sensory, if you take roof into consideration, it is supplied by the greater palatine nerve and nasopalatine nerve, which are branches of maxillary nerve, because it is on the upper side. Now floor is below, so it is supplied by the lingual nerve, which is a branch of the mandibular nerve, because lingual nerve supplies to the tongue. And the cheek means sides, laterally. They are supplied by the buccal nerve, which are the branches, which is a branch of mandibular nerve. As far as the sensory nerve supply of the mouth is concerned, we have these three portions. And the motor nerve to the muscles in the cheek, called as buccinator, and the muscles of lip, which is called as the orbicularis oris muscle, are supplied by the branches of the facial nerve. Because facial nerve is a muscle, is a nerve for the muscles of facial expression, and buccinator and orbicularis oris, these are the muscles of facial expression also. Now applied under me is stomatitis. Stomatitis means inflammation of the mucous membrane of the mouth. म्हणजे तोंड येणे आपण जे म्हणतो ना त्याला स्टोमॅटायटिस म्हणतात. ओके. आणि कार्सिनोमा means cancer, because mouth is prone for most of the carcinogenic agents, including food, drugs, and what you call all those addictable substances or substance abuse of tobacco and so on. Now what is tongue? We will have in short anatomy of the tongue. Tongue, it is a mobile muscular organ, and it is mass of striated muscles covered with a mucous membrane. It is divided into right and left halls by the medium septum. So there is a medial septum, and it has got three parts. First is oral part, which is anterior two-third, and it is mobile also. Next is pharyngeal part, which is posterior one-third, and more or less it is fixed. And plus it has got a root or a base. And it has got two surfaces. Dorsal means upper surface and ventral means lower surface. Anatomy of tongue is very, very essential for the purpose of exam. Many times questions are posed on tongue. Now let us understand the dorsal surface of the tongue. The dorsal surface of the tongue is divided into two, anterior two-thirds and posterior one-third, by a V-shaped sulcus terminalis. You can see sulcus terminalis here. It is V-shaped. Okay. The apex of the sulcus faces backwards and is marked by a pit called foramen cecum. So here the foramen cecum is located. You can see foramen cecum here, sulcus terminalis and foramen cecum. Foramen cecum, it is an embryological remnant which marks the site of the upper end of the thyroglossal duct, which comes from the thyroid to tongue, thyroglossal duct. So this is about dorsal surface of the tongue. And the remaining part of dorsal surface includes the various papillae on it. So anterior two-third mucosa is rough, and it shows four types of actually papillae: filiform, fungiform, circumvallate or vallate, and foliate. depending upon their shape, they are so named as. Everybody should know these 4 types of papillae. Okay, the posterior 1/3 has got no papillae but shows nodular surface because of underlying lymphatic nodules, which are also called as lingual tonsils. So just remember that there are three types of tonsils in the mouth. Those which are on the side are called as palatine tonsil. You can see palatine tonsil here. This is palatine tonsil 1, palatine tonsil 2. Other tonsils are placed on the back of the pharynx, opposite to the mouth. So it is called as pharyngeal tonsil. So pharyngeal tonsil means which give rise to the adenoids. Pharyngeal tonsil. And the third tonsils are located on the posterior 1/3 of tongue, and they are called as lingual tonsils. So commonly the tonsil word is used for the palatine tonsil, which are located on the side. But there are other tonsils also. As a doctor, you should know this. Usually people come to the clinic with the tonsillitis, and that tonsillitis is palatine tonsillitis. Sometimes they come with the pharyngeal tonsillitis, which is called as adenoids. And lastly, the tongue tonsil, that is lingual tonsils, may also get inflamed. So posterior 1/3 is for tonsils and anterior 1/3 is for papillae. The papillae contains the taste buds. You can see all these papillae is given, and their location is fixed. Okay, you can see the circumvallate at the in front of the sulcus terminalis, and on the side you can see the foliate papillae, and in the middle you can see the fungiform and filiform. Now ventral surface means below the tongue. It is smooth. It doesn't have any papillae. In the midline, anteriorly, a mucosal fold called as frenulum is present, which connects the tongue to the floor of the mouth. And lateral to the frenulum, you can see the deep inguinal vein, which can be seen through the mucosa. If you lift your tongue and watch in the mirror, you can also see that deep lingual vein. Lateral to the deep lingual vein, a fold of mucosa forms the plica fimbriata. You can see plica fimbriata on the side also. This is about ventral surface of the tongue. And now let us understand the muscles of the tongue, because tongue is a muscular organ, and tongue is composed of 2 types of muscles: intrinsic muscles and extrinsic muscles. Intrinsic muscles who take origin and insertion in the tongue itself. They don't require any bone for that to take origin or insertion. Whereas extrinsic muscles, they take origin outside the tongue from some bone, and they come for insertion in the tongue. So they are called as extrinsic muscles. So there are 8 muscles, 4 intrinsic and 4 extrinsic. The intrinsic muscles, I told you, they are inside the tongue and they are confined to the tongue. Confined to the tongue means they are limited only to the tongue, and they do not have any bony attachment or bony origin or bony insertion. And they consist of superior longitudinal, inferior longitudinal, transverse and vertical. In other words, you can say 2 longitudinal muscles, 1 transverse and 1 vertical. So altogether 4, and their function is to alter the shape of the tongue. If you take out your tongue from your mouth, you can make a roll of it, you can fold it. So that is all altering the shape of the tongue is the main function of these intrinsic muscles. And there are 4 extrinsic muscles as well, and they are coming from outside, means they are originating from outside the tongue and they come for insertion on the tongue. They connect the tongue to the surrounding structures like the soft palate and the bones, including mandible, hyoid bone and styloid process. Styloid process is a part of temporal bone. Okay, hyoid bone is independent bone, and mandible you know. And soft palate also, there is no bone, but there is a soft tissue. And the names of these extrinsic muscles are palatoglossus, genioglossus, hyoglossus, and styloglossus, all glossi. And the first word denotes from where they are coming. First one is coming from palate, second one is coming from genu of mandible bone, third is coming from hyoid bone, and fourth is coming from styloid process of the temporal bone. So you should know the names of the bones also. And these all 4 extrinsic muscles help in the movement of the tongue. So protrusion of the tongue, retraction of the tongue, elevation, depression, and every action of the tongue other than alteration of shape is all done by extrinsic muscles. And the movements which we see on the tongue are protrusion, retraction, depression, elevation. The genioglossus on both the sides act together for protrusion. Okay, like this. And retraction, styloglossus and hyoglossus on both sides acting together will give rise to retraction. Depression is done by the hyoglossus and genioglossus on both the sides acting together. And elevation is done by styloglossus and palatoglossus on both sides acting together. So which muscle help in protrusion and retraction and depression and elevation of the tongue are the different muscles which are helping you for these movements. Now here you can see different movements of the tongue and the alteration of the shape of the tongue. And this is a combination of intrinsic and extrinsic muscle action. You can see different movements here. Somewhere there is a protrusion, somewhere there is a retraction, somewhere there is elevation, somewhere there is depression, somewhere there is a rolling of the tongue with what you call folding of the tongue. Different movements you can see here. Next, what is the nerve supply? Nerve supply of the tongue is quite complex and extensive because there are different nerves doing different job here. Now let us understand first sensory nerve supply. The sensory nerve supply means general sensory, pain, touch, temperature. Spatial sensory means taste sensation. So there are two types of sensations, general and spatial. So there are different nerves for that. Plus there is a motor function here. Now anterior two-thirds of the tongue is supplied by the lingual nerve for general sensation. And lingual nerve is a branch of mandibular nerve. Mandibular nerve is a branch of trigeminal nerve. Okay, from the sensory root of trigeminal nerve. And the spatial sensation means taste sensation. Taste sensation means gustation. For the anterior two-thirds, we have a chorda tympani nerve, which is a branch of seventh cranial nerve. So fifth cranial nerve is for fifth cranial nerve is for the general sensations, and seventh cranial nerve is for the spatial sensation as far as anterior two-thirds of the tongue is concerned. Whereas posterior one-third is supplied by the glossopharyngeal for both the purposes, general sensation as well as spatial sensation. So it's glossopharyngeal is the ninth cranial nerve. So if you saw fifth cranial nerve, seventh cranial nerve, and ninth cranial nerve, these are sensory nerves, out of which fifth is only general sensation, whereas seventh and ninth, they are spatial sensory as well. Now the base of the tongue is also supplied by the sensory nerves, which are derived from the vagus nerve, a branch of vagus nerve called internal laryngeal nerve, which is a branch of vagus nerve. So vagus nerve is both general and spatial sensory, means general sensations and taste sensation for the base of the tongue. So altogether for taste sensation, we got three nerves now. Seventh cranial nerve via chorda tympani, the branch of glossopharyngeal nerve, and branch of vagus nerve, which is called an internal laryngeal nerve. And for general sensation, we got again three nerves. First is fifth cranial nerve through lingual, ultimate lingual branch, glossopharyngeal nerve, and vagus nerve is also general sensory. So this is about sensory nerve supply of the tongue. Now we'll go to the motor nerve supply of the tongue. Motor is required for the movements. And I told you there are 8 muscles altogether. Out of these, all 8 muscles, all the intrinsic muscles, means the 4 of them are supplied by the hypoglossal nerve. And extrinsic, out of 4, 3 are supplied by the hypoglossal nerve, except one muscle, that is palatoglossus. So if you say 4 intrinsic and 3 extrinsic are supplied by the hypoglossal, one which remains is a palatoglossus, and palatoglossus is supplied by the pharyngeal plexus, and this pharyngeal plexus is formed by the cranial part of accessory nerve, means 11th cranial nerve has got 2 parts. I told you that is cranial accessory nerve. You can see cranial part of accessory forms pharyngeal plexus, and this supplied the palatoglossus muscle. So palatoglossus is only exception here as far as the nerve supply of the tongue is concerned. So out of 8, 7 are supplied by the hypoglossal and 1 is supplied by the accessory nerve, that is palatoglossus. You can see all those muscles here in this diagram. Now what is blood supply of the tongue? Tongue is also bloody organ because a lot of blood supply is given to it. The arteries which supply the blood to the tongue are lingual artery. Lingual artery is a branch of external carotid artery. Tonsillar branch of facial arteries. Facial artery is also branch of external carotid artery. It gives rise to tonsillar branch, and tonsillar branch supplies tonsils plus tongue. And another is ascending pharyngeal artery, which is again a branch of external carotid artery. You can see all the branches of external carotid artery going here to supply the tongue. Now, venous drainage of the tongue is carried out by the lingual vein, which ultimately drains into the internal jugular vein. So, lingual vein is a very is the only prominent vein which drains the blood from the tongue as far as venous return is concerned. Now, what is lymphatic drainage? Lymphatic drainage, we have seen it during the study of various triangles of the neck, and as well as while studying the submandibular region, we have seen all this. One, submental nodes are drained by the tip of they drain the tip of the tongue. So tip means जिभेचा सेंडा. So submental nodes bilaterally, and then the lymph is further drained into the deep cervical nodes. For anterior two-third, there is a submandibular lymph nodes which are located in the submandibular triangle or digastric triangle. They are unilaterally they drain, and then further it is drained to the deep cervical nodes. Whereas posterior one-third of the tongue is drained into the deep cervical nodes, and these deep cervical nodes are also called as jugulodigastric node. I have shown you the jugulodigastric node. You can see still here in this picture, jugulodigastric node, deep cervical nodes. So these are the lymphatic drainage. So for example, you can understand the pathology, the applied under the tongue with the help of these nodes, because these nodes get inflamed, which is called as lymphadenitis. If the jugulodigastric is inflamed, you can take into consideration that the posterior one-third has got some pathology. That's what it helps us. Now, what are the functions of the tongue? Of course, the tongue is mainly for the taste sensation, and plus it helps you for the articulation purpose in order to produce the language words, speech. So speech production plus mastication plus deglutition plus gustation. म्हणजे बोलण्याकरता मॅस्टिकेशन म्हणजे चावण्याकरता, खाण्याकरता, डेग्लुटेशन म्हणजे गिळण्याकरता, आणि गस्टेशन म्हणजे त्याच्यातून टेस्ट घेऊन to have a pleasure of what you eat. So it's called as a gustation. The tongue is the most important articulator for speech production. So the voice is produced in the voice box. We call it as larynx, and sound is produced in the paranasal air sinuses. So we call it as a sound box. And whereas mouth is a speech box, where tongue is the articulator for the production of speech. During speech, the tongue can make amazing range of movement, and that movement is essential. Without movement, you cannot, speak. And plus, it helps in mastication. Mastication means chewing. So there are muscles of mastication, 4 types. You know that, 4 of them. And deglutition means unless and until you take first step of deglutition like this, here tongue has an important role. Then the food goes further. The primary function of the tongue is to provide a mechanism for taste. T-A-S-T. Taste means taste sensation. It is also called as gustation. Birds are located on different areas of the tongue on the papillae, but are generally found around the edges. काटावरती जास्त असतात ते. They are sensitive to the 4 main taste. 4 primary चव असते, टेस्ट असते. Bitter म्हणजे कडू, sour म्हणजे आंबट, salty म्हणजे खारट, आणि sweety or sweet म्हणजे gold. So these are the areas where you have those taste based predominantly. हे निळे आहेत ते bitter आहेत. ह्या ठिकाणीच तुम्हाला जास्त कडू लागेल. Sour means आंबट. So these are yellow patches inside the edges. And salty means mostly on the lateral edges and little behind the tip. And the tip of the tongue is mainly for the sweet. So you can see this diagram. Don't forget this diagram as far as the gustation is concerned. And these taste buds are the receptors of taste sensations which are present in those papillae which we saw earlier. Now, the tongue is also needed for much other functions like sucking, chewing, swallowing, eating, drinking, kissing, sweeping the mouth for food debris. Okay? कुठे अन्न वगैरे अडकलं असेल तर ते काढण्याकरता, and other particles, and for making funny faces also. फनी फेसेस म्हणजे असं एडवून दाखवणे वगैरे करून वगैरे सगळं ते आहे ते सगळं. पोकिंग द टंग आउट अँड वॅगलिंग इट. ओके, जिभेचा वापर अनेक कामाकरता केला जातो. अजून तुम्हाला माहिती असेल मला नंतर सांगा. Trumpeters means those who use these trumpets or saxophone. You can see these pictures and images here. And horn म्हणजे लांब प्रकारचे वाद्य असतात. And flute. Okay, players have very well developed tongue muscles and are able to perform rapid controlled movements or articulations. You can, in the images you can see all that. Now what is the clinical anatomy of the tongue? The main thing is lacerations of the tongue. Laceration म्हणजे तुम्हाला लॅसरेशन आता शब्द FMT शिकल्यामुळे माहिती आहे. खरचटलेल्या जखमा. And ulcers means oral ulcers, mouth ulcers. Another is glossitis. Glossitis means inflammation of the glossa म्हणजे tongue, inflammation of the tongue. Another is carcinoma means malignant tumor of the tongue, जिभेचा कर्करोग. Tongue tie is due to large frenulum. टंग टाय म्हणजे जर फ्रेन्युलम जर मोठा असेल, पुढे पण असेल, तर त्याची डीप वरती उचलत नाही. यू कॅन सी इन दिस पिक्चर. दिस इज टंग टाय. द फ्रेन्युलम इज सो लार्ज दॅट द पर्सन इज नॉट एबल टू लिफ्ट द टंग अप. दिस इज नॉट टंग टाय. दिस इज अ फनी पार्ट. हा टंग टाय आहे. अँड इट इज ऑल्सो कॉल्ड एज अँकिलोग्लॉसिया. ओके. नाउ lesion of the hypoglossal nerve will also give rise to clinical anatomy. The protruded tongue deviates towards the side of the lesion. याची जीभ सतत एका बाजूलाच वाकत असते, कारण का deviates towards the side of the tongue. So that means there is a lesion in the hypoglossal nerve and tongue gets atrophied and wrinkled in that case. So this is a hypoglossal nerve injury, nerve lesion causing some little sort of paralysis of the tongue. Now, anger is a condition in which the tongue works faster than the mind, and usually the person who is angry, he expresses that his anger through his mouth in terms of words. So, for example, the main are bad words. Bad words म्हणजे शिव्या देणे. शिव्या देणे हे जिभेचं काम आहे. जिभ ही काम करते शिव्या देण्याचं, परंतु ते असतात डोक्यामध्ये. सो म्हणून म्हणतात की faster than the mind. So mind ज्याचा डिस्टर्ब झाल्यामुळे तो gone. Yes. So if there is goodness in your heart, it will come to your tongue. So तुमचं मन किती चांगलं आहे त्याच्यावरती अवलंबून आहे. तर जिभेला दोष देण्यात काही अर्थ नाही. मन म्हणा किंवा माइंड हेच आपलं दोषी किंवा निर्दोषी असू शकतं. जीभ ही निमित्त मात्र असते. ओके. तुझी जीभ खूप चालते असं म्हणून काहीच चालणार नाही. काय असेल ते तुम्ही मनाची ट्रीटमेंट केली पाहिजे. जीभ ही वापरली जाते. नाउ वी गो टू पॅलेट. पॅलेट मीन्स it is a part on the upper side of the oral cavity. So it lies on the roof of the oral cavity proper. Oral cavity proper means behind the teeth. Has two parts. Hard part is a bony part which is located anteriorly, and soft part is a muscular part which is located posteriorly. So soft part has got a muscles and mucous membrane. Now we'll see the hard palate. It lies on the roof of the oral cavity. You can see here hard palate, and चार plates are बघा. It forms the floor of the nasal cavity because above that there is a nasal cavity. It is formed by palatine process of the maxilla in front. So these are the two palatine processes of the maxillary bone. So high maxilla and toe maxilla, right and left, in front, and horizontal plates of the palatine bones behind. So these are the palatine bones. So these are independent palatine bones, whereas these are the parts of the maxillary bone. They are bounded by the alveolar arch. Now this is alveolar arch. This is upper alveolar arch, you can see, because we have a lower alveolar arch which doesn't take part in hard palate. Hard palate communicates posteriorly with the soft palate. So behind the in the behind portion or in the backside portion of hard palate there is a soft palate. Its under surface is covered by the mucoperiosteum. So the hard palate, below the bone there is one mucoperiosteum material, and it shows transverse ridges in the anterior parts. Soft palate will I understand now. It is attached to the posterior border of the hard palate. Here you can see hard palate has ended and soft palate has started. It is covered on its upper and lower surfaces by the mucous membrane. Now it is composed of muscle fibers, aponeurosis, lymphatic tissue, glands, blood vessels, and nerves. Palatine aponeurosis is a fibrous sheath. It is attached to the posterior border of the hard palate, and it expanded tendon to the tensor veli palatini. It is a muscle splits to enclose musculus uvuli. So musculus uvuli आपण त्याला म्हणतो पडजीभ, ही musculus uvuli, or it is also called as uvula. It is a projection. Gives origin to the insertion to palatine muscles. Now, what is uvula? In short, it is it is also called as musculus uvuli. Here, uvuli पडजीभ म्हणतो आपण. ही जीभ नाही, पडजीभ कारण ती नंतर नेझोफॅरिंक्सला बंद करते गिळताना. While deglutition, it helps. It hangs from the soft palate, and it prevents entry of food and water into the nasopharynx at the time of deglutition. So this is uvula, and muscles of uvula are tensor veli palatini, levator veli palatini, and musculus uvuli. So these are all small muscles, and if you should know only the names, if you know the original insertion and action, it is well and good, but I propose you just remember the names of these muscles. And other muscles are palatoglossus and palatopharyngeus. So palatoglossus is going to the tongue, plus it also is a part of palate muscle, so it is counted here also. And palatopharyngeus is another muscle from palate to pharynx. So this also muscle is present on the side of palatoglossus, and here दोघांच्या मध्ये palatine tonsil असतं. Okay. Now sensory nerve supply of the palate is derived from maxillary nerve through greater palatine, lesser palatine, and nasopalatine nerve. And glossopharyngeal nerve is nerve supplies to the region of the soft palate also. So maxillary म्हणजे fifth cranial nerve ची branch, and ninth cranial nerve सरळ आहे. Motor nerve supply is derived from the pharyngeal plexus. I told you at the time of tongue. And pharyngeal plexus is formed by the cranial accessory nerve. So it supplies that palatoglossus also and palatopharyngeus also, plus tensor pili palatini, and nerve to medial pterygoid, which is a branch of the mandibular division of the trigeminal, supplies the tensor veli palatini. The blood supplies from the maxillary artery, which is a branch of external carotid artery, plus a facial branches. The facial artery also gives to rise to ascending palatine artery, and plus external carotid chi a dusri branch, ascending pharyngeal branch, is also supplying the palate, just like tongue. Okay. And applying anatomy of the palate is cleft palate. You can see this child suffering from cleft palate. It's a congenital anomaly. It can be unilateral, bilateral, or median. So this is a cleft palate. Cleft palate म्हणजे palate ला फट असणे. And paralysis of the soft palate is the pharyngeal isthmus cannot be closed during the swallowing and speech. The paralysis of soft palate can also take place due to damage to the nerve supplying it. And other is uvulitis, just like glossitis, inflammation of uvula, and also carcinoma of uvula you can see in some cases. This is applied anatomy of palate. And finally, we have come to the palatine tonsils. So greatly talked about palatine tonsils because this is a very important clinical organ in our body. Usually people coming to the clinic are tonsillitis. Tonsil सुजले म्हणून येणार आहे, हाच तो tonsil, and तो खराब त्याचं नाव palatine tonsil आहे. Tonsil means it's an almond shaped lymphoid tissue which is meant for phagocytosis. It is bilateral, means it is present on both the sides in the fauces, located in the tonsillar fossa between anterior and posterior pillars of the fauces. Anterior pillar is formed by the palatoglossal arch, and posterior is formed by the palatopharyngeal arch. So you can see palatoglossal arch in front and palatopharyngeal arch behind. Each arch contains one muscle of the same name. So palatoglossal muscle एका arch मध्ये असतो आणि palatopharyngeus एक muscle दुसऱ्या arch मध्ये असतो. Palatine tonsils, if you see the features in details, we have two surfaces to show on the palatine tonsils. One is medial surface and other is lateral surface. And so there are two borders, anterior border and posterior border. Again, there are two poles because it is almond shape, upper pole and the lower pole. And apex is at soft palate where both arches meet, and base is at the posterior 1/3 of the tongue. Okay. Palatine tonsils are supplied by tonsillar branch of the facial artery. This is blood supply, and other branches from the external carotid artery. Venous drainage is going to pharyngeal venous plexus, and lymphatic drainage to the tonsillar lymph node located just below the mandible, so just below the angle of the mandible here. So tonsil आतमध्ये सुद्धा ना तर इकडे कळ येते because of the inflammation of the lymph node, because it drains the palatine tonsils. Nerve supplies by the pharyngeal nerve. Nerve supplies by the glossopharyngeal nerve and lesser palatine branches of the spinopalatine ganglion. And applied anatomy of the palatine tonsil is tonsillitis, commonly called tonsillitis. And if this gets highly decomposed or in what you can say pus formation in the tonsils, is give rise to the quinsy. Quinsy another condition आहे. Bleeding from the tonsil fossa after tonsillectomy is quite common. Tonsillectomy means operation करून tonsil बाहेर काढणे. So this is all about the today's study on oral cavity. We have covered the mouth, we have covered the tongue, we have covered the palate, and we have covered the palatine tonsil. If you have any questions, you can ask me, because last 1 minute my hand. If you have any questions, you can ask me.
Sir, what is a taste of delicious?
Taste of
Hello, sir.
delicious.
Sir,
Delicious is a expression. Delicious is a expression to the
delicious.
taste. Expression. It is an expression. Delicious means very good. So there is no taste in anatomy. There are only 4 tastes. Others are combination and permutation and combination of all those 4 tastes. Anatomy मध्ये physiology मध्ये फक्त 4च टेस्ट आहेत. Bitter, sour, salty and sweet. तिखट पण टेस्ट नाही. तिखट is a combination of different tastes. Okay. Any other question?
Thank you.
Okay, we will end here and we will come with another topic some other day. Mostly tomorrow I'll tell you the topic, or you can tell me right now which topic you want tomorrow.
Sir, lateral wall of nose.
Okay, tomorrow we will take nose and mostly the lateral wall of the nose. Thank you. Thanks a lot. See you again back tomorrow.